All right, my name is Kevin Denholm, and I'm the co-founder of Social Patient. Social Patient, the mission of Social Patient is to transform the way we deliver healthcare by connecting patients to their healthcare providers. So what's the problem that Social Patient addresses? It's treatment adherence. And what do I mean by treatment adherence? That means if you walk into your doctor tomorrow and they diagnose you with a chronic condition, and the chronic condition that we're focusing on right now is diabetes. If you get diagnosed with diabetes, you're going to get some kind of treatment plan that you need to adhere to after you leave that doctor's office. More than likely, you're going to have a meal plan, you're going to have some kind of physical activity plan, you're going to have a drug regimen, and for diabetics, you typically have to take your blood glucose measurements. The problem is that for the first 30 to 90 days after a diabetic is diagnosed, they do a pretty good job of adhering to that treatment plan that their doctor gives them. But after that 90-day period, it drops to below 50%. And over 2 years of a time frame, a person with a chronic condition is only between 10 and 40% likely to be adhering to what their doctors have told them to do. So what is Social Patient's solution to this problem? Basically, we want to touch the patient as soon as they get diagnosed by their doctor. We want partnerships with doctors and hospitals so that as soon as a patient goes into their physician, they're diagnosed with diabetes, that physician recommends a Social Patient treatment plan that directs that patient as soon as they leave the office on what they need to do in order to maintain their health. So that connects their blood glucose monitor, whether that's wirelessly or through some wired connection. It also connects them to different social networks, allows them to join teams and other groups that compete and do things to keep them physically active, and it educates them from a meal planning and other type of health and wellness capabilities. The other piece of that, and the final piece, is that for everything that they do, so the things that they would do on a normal day anyways, take their blood glucose, interact on Facebook and things like that, we reward them and give them points to incentivize that they continue to do these healthy activities. So what's the overall market size? You guys have already heard a lot about diabetics here. We're focusing on diabetics 20 to 65 years of age. The reason we've narrowed it to that range is because we know that this particular solution is going to require that they have some kind of technological capability. Within the United States, that puts us at 14 million diabetics, but it also has 35 million pre-diabetics that we'd like to actually target as well, because this should be a preventative tool. As far as the local market's concerned, we know that within Michigan, we've got 1.2 million diabetics and 511,000 diabetics just within the Metro Detroit area. On top of that, we actually have a beacon project in the city of Detroit, which is aimed at texting people to try and get them to take blood glucose and do things that are for their health. They have actually been in hospitals recently where they've seen those numbers as high as 40%. So the 511,000, that's only 11%. The estimates at the high end for some of the studies that have been done, including one we did in Eastern Market, are as high as 40% for the number of people that have diabetes in those areas. So how do we make money? So we partner with hospitals, physicians, and what are called accountable care organizations. And those companies pay us an annual license fee of $300. Why do they pay it to us? Well, those hospitals and physicians align with these accountable care organizations, and the idea is to ensure that patients, such as those with diabetes, don't have to go to the doctor as often for maintenance and other types of things that they would typically get sick for. So what happens is if the patient does not go to the doctor or to the hospital for repeat types of services, the savings by not having to go to the hospital are tallied within those accountable care organizations, and then those savings are dispersed. They pay us for helping them to get those savings. In terms of potential customers, we've already instituted conversations with Carmano's Cancer Institute, Trinity Health, and we've actually been put in touch with Partners of Care to start working, and Partners of Care is an ACO organization that we're hoping to talk to and figure out if we can do some beta testing with them. As far as engaging the community, I've already said that we actually did a survey down in Eastern Market of 100 plus users in order to get some insights into what they would actually like from a rewards perspective, as well as the tools that they value the most. We actually have local church engagement. We got 2 churches that we're planning to get into in the next couple weeks in order to do some beta testing with them. And then we're also conducting some more usability studies with other local markets such as the Gloria market.